This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Winson Cheung. Dr. Cheung is a medical oncologist at the British Columbia Cancer Agency, Vancouver Center Clinic. Thank you very much for coming to speak to us, Dr. Cheung. Really interested in what you're going to discuss with us, your abstract regarding reproductive and sexual health among young adult survivors of cancer.
Thanks for having me.
Talk to us about your research and also how you became interested in this subject.
My research program really focuses on the vulnerable subsets of the population, and I think young adults with cancer kind of fits into that definition. So that's really the impetus for doing projects in this kind of patient population. And I think in this young population, I think fertility and sexual health are really relevant and pertinent issues. So that was really the rationale for doing a project focusing on this area. And really we reviewed the charts of these young individuals to see how often and how frequent these discussions about fertility and reproductive health occurred. And what we found was quite interesting. We kind of went into it thinking that perhaps that this is not discussed enough or sufficiently. And that's exactly what we found, actually, that more than half of individuals never talked about these with their physicians. So that was quite compelling data and quite an interesting finding.
What was the age span of the patients?
So we primarily focused on young adults. So we defined it as anybody who was aged 20 to 39. And we were not very exclusive in terms of tumor type, so we include all patients who were in that specific age range.
How far have we come where young adult men are, from the beginning, encouraged and given the chance to bank sperm?
I think we've come, a long way, but I think there's still definitely room for improvement. In our specific abstract, for example, we do show that there are ongoing discussions at the very first visit where physicians and patients are engaging in this type of conversation. But it's far from optimal, so it's not 100% of patients. We're finding that maybe half of individuals are engaging in these kind of discussions, but certainly we want all patients to have the opportunity to discuss this kind of sensitive topic.
What are the impediments to communication?
Well, in our project, we found some interesting results in that not all centers in our province had a similar rate of discussions, that some of the peripheral centers or smaller areas had a lower rate of conversations in terms of fertility. So we think perhaps commute access to specialists could be potential barriers to having these talks. Perhaps physicians are less likely to engage in these conversations when they realize that there may not be a specialist in that area that can look at fertility or do sperm banking, for example. So I think that could be one reason for the suboptimal kind of uptake of this area.
What is the progress we're making with young women today, the ability to harvest eggs?
I think the opportunity is definitely there, and again, I think our study highlights that these discussions are ongoing. We didn't specifically look at the rates of procedures being done, so I can't really comment on that specific area. But we didn't find any gender differences in terms of rate of discussion. So I think both genders and both sexes are being talked about, and this area is being kind of looked into.
Do you think that more needs to be done to educate young adults in a way that they know going into their cancer diagnosis that these are issues they may have to bring up?
Definitely. I think I definitely agree with that. I think oftentimes when a young person is affected by cancer, there's so much going on in their heads in terms of what to do with their job or school, that sometimes fertility may not be at the forefront of their minds. So I really stress the importance of having patients being engaged in the whole discussion. So I think that would be a very good area to advocate for, to have patients approach physicians and nurses about the topic so that we also feel more kind of forthcoming in talking about it.
What you did learn from your discussions with young adults. What are the differences that are gender specific in discussions with you?
We actually didn't find any gender specific differences. The major kind of impact is the age range, as well as whether they already had children or not. So we did find that those who were young and had no children yet were more likely to engage in conversations about fertility preservation.
What about body image and the issue of sexual health on that level, and the psychosocial component of impact on a young adult body, and how that feels to then try to be out there like your peers, and dating and relationships, all of that?
I think that's a very good point to bring up, actually, because again, in our abstract, we looked at different domains of sexual health and fertility, and we found that the rates of fertility discussions were quite a bit higher than sexual health type discussions. So I think the latter might still be an area that needs a bit more work on. Perhaps the topics that may be less comfortable for physicians and patients. So, I think we did find that discrepancy. So the rate of discussions between these two areas were quite different, a lot lower for sexual health.
In summary of what you learned, tell us about what the key points that you took away from the survey and the research.
I think the findings suggest, that, I'm reassured that there's been some improvement looking at what we found compared to some earlier research 10, 15 years ago. But again, the rate of discussions is in the range of 50%, so there's really half the population where discussions should be occurring, but they're not. So while we're heading in the right direction, I think there's, again, a lot more room to improve on. So I think that's the underlying message. We're making some improvements, but I think further work should and can be done.
What can you share with your oncology professionals? What do they need to know? What can they learn from your work?
I think sometimes as clinicians, we think we're doing something, or we think we're better at doing something than we actually are. So really, right now, at least in Canada, we're trying to disseminate the results, and we're hoping to publish these findings, and really to allow physicians to kind of reflect a little bit on their own practice, and perhaps realize that maybe we're not doing as good a job as we think we are, and again, work towards the common goal of really, openly discussing these really sensitive but important issues.
And on behalf of patients, what would you like patients to know?
I really emphasize the importance of patient being proactive and preemptive and being engaged in their own health. So because these issues such as sexual health and fertility can be somewhat sensitive and perhaps uncomfortable at times, I would encourage patients to perhaps bring these issues up with their physicians and really prompt their physicians to be engaged in these kind of topics and issues.
Thank you so much, Dr. Winson Cheung, medical oncologist at the British Columbia Cancer Agency, Vancouver Centre Clinic, joining us from Canada.
Great, thanks again for having me.
Pleasure.